It was right there.
Lord, I wasn't over far enough. I cannot freaking believe this.
Well, we're live now.
Okay. All right. Well, let me go. All right. So, for those who have joined, thank you very much. Um, Before we get started, this is my first live, so we're gonna have to chalk it up to a learning experience. And all this time, I didn't go over far enough to see the go live button. So anyway, here we are. This is my premiere episode of Chat with the Coding Nurse, and our special guest is someone who I know personally, someone who I have a lot of respect for, and her name is Mrs. Raquel Wilkinson Alston, and I will allow her to introduce herself before we get started. Raquel, please introduce yourself.
Hi, thank you for this opportunity. I am an author, I am a mother, I am a consultant, and I think I'm looking forward to learning more from the coding nurse. The coding nurse, again, I know the coding nurse personally, but the way we met, very interestingly, led to a lot of changes in my life and the way I view healthcare and nursing. So I'm really excited to chat with the coding nurse and see if there's more for me to learn, but also for us to, exchange some ideas, and hopefully the viewing audience can benefit from some of the topics we discussed today.
Thank you so much. So, my first question, Raquel, is can you describe for us your path into the nursing profession?
So interestingly enough, I worked as a therapeutic staff support. I was working more in behavior health and like more of a social work kind of capacity, more behavior health than anything. But of course, I seeing the many needs, especially in underserved communities, predominantly Black communities, for like coordination of care, I've always kind of been drawn to that kind of professional work. So when I became a nurse, I was more so looking for an opportunity to kind of continue to work in that capacity. So I remember being really drawn to psych nursing. So kind of went that route first. And I worked in psychiatric as a psychiatric nurse for about 2 years. And then I went into care coordination, and I was working through the VA. They had there was a program that was specifically for veterans who were having issues with like chronic homelessness and like poor coordination of care. And so kind of getting them back on the pathway, connecting them back with the VA medical center and their services through like primary care services, and uh, helping with medication management became something that I took more than just a professional job, but I kind of took it personally. I really seen the benefit of nurses working in that capacity. So ever since then, I've just been in care coordination. So even now, that's what I do. I work for a major health insurance company, and I do post-acute care coordination and also work in analytics. So that's kind of an
Okay.
interesting combination of care management.
Well, can I tell you, care management and analytics, anything dealing with data and healthcare analytics is a win. I mean, that is definitely a recipe for success, and you can guarantee and write your own paycheck for the next 25 years because everything now is about data, because everything is about cost containment or how it directly affects cost. So, my next question, Raquel, is when did you initially become interested in transitioning into the health information management industry?
Hmm. I think when I was working with the veterans in the care coordination, the role that I was working in, it required that we worked across the VA medical center, their system, the VA medical EHR system, and the EHR system for the company that was contracted as like the third party to do the care coordination. So working between those two systems, I noticed there was a lot of decisions that we could make just by having access to this data. So we could see when the patients pick up their medication. So we had a good idea of like medication adherence. And with that, I really thought to myself, I think I would like to work specifically like in this space. So it was kind of hard to communicate that to other nurses. I think even to like nurse managers who I was working with. And when I would, have conversations like this with nurse managers, I think sometimes it almost sounded like I was talking like a dreamer. So I think it was about then, and then probably around 2016 when I was in graduate school. I graduated in 2016 with my master's in nursing education. I started to become more keenly aware of the importance of like looking at like healthcare data. So I would probably say about then, but I think what really sparked it was when I met you. You kind of helped me to like realize what it looked like professionally and like what options kind of was out there for nurses. Because I felt that there was a connection there. But when I met you, you actually embodied that connection. You were the first person I ever met that that was for lack of a better word, like the best of both worlds. So um, yeah. So I would probably say it started back when I was working as a case manager or care coordination within the veteran population as a nurse. But then definitely what really kindled, I would probably say, was when I met you.
Okay.
Mhm.
Well, thank you. And what do
Mhm.
you find most interesting about the HIM industry?
Well, first of all, how dynamic it is. If I have not found anything more fascinating, it is how dynamic it is. There are many different um, professional roles, many different responsibilities. Every company that deals with health information deals with it differently. And then you have organizations such as the HEMA, ACDIS, um, um, AAPC, um, that they have ways of, how should I say, kind of leading the charge on moving professionals in the right direction as far as like with relevant information, access to relevant information, changes in the industry. So I would probably say I'd probably say that, yeah, sure.
Because I think that's what I really wanted to when I thought about creating this channel. Basically, I just started just telling my story how I wanted to just get away from the bedside, how I wanted to do something different, and how coding just kind of like literally fell into my lap. And I'm like, I know there are a lot of other people, there are a lot of other nurses who want to do something different but don't know how. They think they're going to have to take these massive pay cuts, and they think they're not going to be able to utilize their skills anymore. And coding is that perfect bridge. I mean, you get to use all of your clinical skills. You get to use your medical terminology, your anatomy, physiology, your pathophysiology, all of that.
Hmm.
And you
And now
just get
that's
to
how I
use
feel
it.
about risk adjustment. Oh, sorry, as you were saying.
But no, you just get to use
No.
it in a different way. So,
Mhm. And that's how I feel about risk adjustment. That is the same thing you're saying. I mean, honestly, the key to risk adjustment, for at least for me, when I say the key as far as the entry point, I think is understanding coding, like understanding your ICD-10 coding guidelines, understanding, um, let's say, HEDIS measures. I think those are like kind of like nice starting points because I feel like if you understand um, the coding guidelines, if you understand HEDIS measures, I think for nurses, it's easy kind of to make that connection because now you're kind of answering almost like the why, like, why are we doing this? Because what happens often with nursing is very task oriented. So if you, it's so don't get it twisted. You could work in nursing for years, several years, and uh, and someone could ask you what you do on a daily basis. What is the day in the life of your role looks like, and you could explain that all day long and still never really get down to the why of what you're doing. And
right.
that is some of, I would say, some of the most, I guess, surprising yet disappointing aspects of nursing. And I agree with you completely. For me, I was never really in love with the bedside. I never worked, and the closest I'd say I worked in bedside was when I was working as a psych nurse because I worked in like inpatient psych. But of course, it wasn't that typical med surge. So, my thing is, what do you tell nurses who, when they're in nursing school and they're being told, oh, you got to go in the hospital. Oh, if you don't get bedside nursing, if you don't go in a nursing home, you're not going to be able to get, you're not going to be a good nurse. You won't know anything about nursing. Well, what happened to all the talk about nursing being dynamic,
Right.
right? So,
Because the what I find so interesting is, like, I have spoken to lots of nurses who go to my website, send me an inquiry. Just as many specialties as there are in nursing, there are those same specialties in coding. The
hmm
exact same, exact same. And I
hmm
have nurses who have reached out to me. They've had 20 years of OB experience, 20 years of labor and delivery. So if you have 20 years of labor and delivery experience or 20 years in a specialty, why would you want to do anything else? Why wouldn't you just go? But they're not aware. They're not aware that you
didn't
can
know.
go and get a specialty coding credential in that specialty, and that would make you, as you know, you have all you need is a credential and some experience to become really a subject matter expert. You can actually, from that point, go and you could become a provider educator because you already used to interacting with physicians. You already know how to, pretty much everything there is to know clinically about labor and delivery. You know all about the stages of birth and uh, antepartum, postpartum, all that stuff. So you just need to know how to code, what are the coding guidelines, and how all of this affects reimbursement. So that's what I always advise any nurse is, whatever experience you have, try to go into that specialty first. Then if you want to branch out, then just know that I'm going to have to learn a whole bunch of new stuff. But I think that the easiest thing is, I always say, get in where you fit in and then move around.
And as you could imagine, risk adjustment is something that is very attractive to me because a large part of what care coordination really is looking at the management of chronic conditions. I'm not saying that care coordination does not involve acute infections. However, the management of chronic conditions oftentimes is where you really need the care coordination. So risk adjustment is perfect because, for at least for me, because with risk adjustment, even when you are preparing for your certification exam, the CRC, you you're not looking at the entire every section of the ICD-10 coding manual. You're looking at specifically at the chronic conditions. Now, you do need to feel comfortable coding everything because you will be asked to and expected to code all conditions when you're having certain scenarios. And you may even be specifically asked to code all conditions, even the conditions that don't risk adjust. So you have to be comfortable with coding in general. So I definitely encourage, I'm like a big proponent of, if you want to understand this, before you pick up that book and start coding, looking at tabular, looking at the alphabet index, understand the coding guidelines. It will help everything make more sense for you.
Thank you.
So yeah, but for me, risk adjustment makes a lot of sense to me because it just connects everything with chronic disease management to coding, the reimbursement piece, and more importantly, those encounters between the providers and the patients. Getting the patient in front of the provider is such a huge barrier in care coordination. But in risk adjustment, you learn that that is like key to get that patient seen by the provider so that provider is able to document on that patient, and then therefore we can um, hopefully lead to better outcomes in care management. And of course, more importantly, when we're talking about the money piece, we have the budget to take care of patients' chronic conditions.
And the reason why, well, actually, I started out in risk adjustment, and I had no idea
hmm
it was even a thing until I got into it. And
hmm
I really do like, well, the reason why risk adjustment has such a proactive approach is because they have a certain amount of money, and they have to
hmm
take care of everybody out of that money. So they definitely believe in an ounce of prevention is worth a pound of cure. So
hmm
they want to make sure that if Ms. Jones is an unstable diabetic, they want to make sure she comes in regularly. They want to tightly monitor her, blood sugars, tightly monitor her medication, her insulin, so she won't have to go to the hospital for hypoglycemic or hyperglycemic episodes and cost more money in the long run. So, or
Of
even
course.
people who have like people who have uncontrolled blood pressure, it's just they are very, very big on preventative maintenance, and that's really the way to go. And I think that's how healthcare is going to go, period, especially with the aging population. So I wanted to ask, oh, go ahead.
No, I was just going to say, healthcare is definitely going there. Healthcare is not waiting for um, any nurse educator. That's not waiting for nursing curriculum. It is not waiting on anyone. That's where healthcare is going. It's moving out of the inpatient to the outpatient. And it's either you're going to get with it or you're going to get left behind. And, and with that being said, the options to advance in nursing, they're going to be largely looking at populations, looking at analytics, looking at the data. And my argument often is it's either you're going to be on that menu. When I say on that menu, a lot of these nurses are burning out because they're on the menu. You are on the menu. You are where you are. I unfortunately in the cycle or in the workflow where you are at the front line. And if you want to advance away from that front line, it's going to be about what you know. So if you really want to advance without having to pick up the burden of a bunch of school debt, pick up that ICD-10 coding book, pick up that coding manual, read those guidelines, because you at least will be able to feel confident applying for roles where they just simply ask you, are you familiar? I mean, I've seen so many job postings where they're just saying, are you familiar? Do you know?
Right, right,
So like, do you know them? Do you know what an
right.
ICD-10 code is? So it's like, nurses, especially insurance companies, they are looking for nurses. They want people to come in with this kind of knowledge and comfortable dealing with healthcare data. So, mhm.
Now I wanted to ask, so how has being a nurse helped you transition into the HIM industry?
So well, firstly, as a nurse, and I know I'm gonna get some people angry. I'm gonna get some people angry. I am not saying that coders um, can't understand clinical information, clinical uh, content. I'm just saying that because nurses have that, when it comes to, let's say, looking at medical terminology, understanding disease process when conditions are worsening, I think for me, I think that that's what at least allowed me to have an easier transition as a nurse, because I was already kind of familiar with looking at that information, looking at the terminology, working across different professionals as well. That's something that nurses, especially nurses in a care coordination, you wind up working in with many different professionals, and sometimes you actually have to link with your IT and your HIM staff, um, who your colleagues rather, to help you just do your everyday work. I think a smart nurse will be asking the right questions when they're working with these individuals, like the questions I asked you when I met you. And I'm sure you can remember that fateful day because I'll never forget
Right.
that day. I was like, wait a second. I'm like, and I just see this black man. I'm sitting there like, wait a second. You're telling me that you are a nurse and a coder? I was like a little lost puppy. I'm like, okay, please tell me more. Tell me more. We were at a training,
Yeah,
and I
yeah.
completely walked away from everybody like, no, 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 I'm not worried about this training. Can you tell me, what are you doing at lunch? Okay, because when we
Right.
take a break from this training, I want us to, have more conversation. So I think for me, that transition was a lot easier because of meeting you. But added to that, I think I'm committed to lifelong learning. So, um, nurses who profess to be committed to lifelong learning should also look into areas such as health information management, because this area of healthcare management will never ever stop growing. There are some things in healthcare that have shifted greatly, especially since the enactment of the Affordable Care Act, and some of the major, shifts in healthcare that have changed dramatically. Um, but health information management is going to keep moving, and it's going to be moving, I think, at a rate where nurses will see an opportunity for growth, for their own personal and professional growth and advancement. So, yeah. Mhm.
Now, now I do understand what you're saying about nurses versus non-nurses, but the HIM industry was created and it has been held down by non-nurses forever. And if it wasn't for the non-nurses, there would be fewer opportunities for nurses because nurses just tend to shy away from it. And I know me, like I have learned more from from people in HIM who are not nurses than people who are nurses because nurses seem to be kind of stuck in a mindset sometimes. And whereas I find that um, people who come into it from a non-medical, a non-clinical setting, they tend to definitely go by the rules. They definitely know the guidelines inside and out. And I think that nurses kind of, get stuck on, well, it should be this way versus, well, the guidelines say it has to do it this, you have to do it this way. So there's really no point in even carrying on this conversation because you have to do what the guidelines say. And I think that even when I teach nurses, I in my coding classes, I mean, I know because I spoke to another trainer. She's not clinical, and she also teaches coding, and she says that she struggles when she has nurses in her course because like they go back and forth over everything. And I told her, I said it's really not meant to be confrontational. It's just how nurses are taught. Like you are taught to ask because you have to understand like the rationale. Like there's a thought process called the nursing process. And once you start thinking that way, you can't unthink another way. So it has to, they want to know why, because it has to make the rationale has to make sense. So it's just a little extra step, and it is trying for people who aren't aware of it. But by me being a nurse, I understand it, and I know how to speak to people who come at it from that standpoint.
Oh, I completely agree with you. I think what happens oftentimes with nurses, again, I'll say guilty as charged. I too find myself having to pull away from that kind of, task oriented way of doing things. And again, what you're saying about, kind of being stuck in their own rationale of why, right? So I think if you challenge yourself to kind of open your mind, you kind of get to you become more curious about other whys, right? So like for instance, nursing is often led by medicine. So because nursing is led by medicine, most of what our whys is because a doctor said so,
Right.
right? And so when someone comes to you and gives you another explanation, again, this is the reason why I push data so much and understanding and appreciating data and data analytics, because then it offers you some more whys. Because when you start look at data and data analytics, now you have opened that door wide open to a bunch of different whys. And then specifically what you said about HIM, they're looking at the information from a very different standpoint. So they're doing other things with this information, the patient's information, and clinical information that the nurses should be curious about. Okay, well, I know why I need to do this as a nurse, but that is not the end all be all, say all of everything. How are other professionals using this information, or what are other, because not to go off, but let's look at the example. Let's say something like Netflix, for example. You know, the way they the way they handle customer data and what you click on and how long you stay on a particular content. That's how Netflix is able to recommend shows to you, right? Because they're using this information. It doesn't matter why you are doing something. it matters on the other side what other people are going to be doing with the information that you're doing. That's the reason why when you're on your phone, you're getting so many suggestions about news articles and other things, because the data that the way we interact with um, our devices, everybody's using this information for different reasons, for different things. So it's almost like
Right.
for a nurse to think that way, that really is very indicative of, kind of not expanding your thought process. Like, we live in a world driven by technology. And, our devices tell us so much more about, and how we use our devices can tell you so much more about an individual, So if you want to be stuck, not asking why and being able to accept whys from different perspectives, right? So not just the why that makes sense to you as a nurse, but also the why, because again, here's another barrier that leads to, if you have to repeatedly tell a provider about different documentation that's going to lead to inaccurate or um, wrong coding, this poor documentation leading to poor coding, right? Or inaccurate coding. Um, the doctor would have to be unstuck as well. You
Right.
can't just be there explaining, well, this is why I wrote this, whatever. Okay, you can explain this why you wrote this, but this is also, if when we go through that auditing process, we can't explain why you're using history of for cancer that you're actively treating. So if we move away from that, we can have the coders code with more specificity, because this right here is misleading. So, um, yeah, I think we have to be able to open up our minds. And again, if we don't do that, we're all going to be stuck.
Right. And because there are that is the you made a really good point about looking at information differently, because clinically nurses are never ever taught to even think about revenue, the revenue cycle, the impact of money on someone's care. You are totally divorced from that. But once you come on the other side, it is all about revenue, everything. And what I try to tell people in my class is like, what have to start thinking about is every ICD-10 CM code you write down is attached to a dollar amount, period. And when you have people like the example you used about the doctor um, using the history of cancer versus active or vice versa, that affects revenue. So if you don't have accurate documentation and you don't have accurate coding, then your reimbursement is going to suffer. And at the end of the day, that is what drives healthcare, is money and reimbursement. And you have to have there's regulatory compliance, there's coding compliance, there's all kinds of compliance that factors into why you code the way you code, why you bill the way you bill, why certain providers, certain insurance carriers require this modifier or require you to code it this way. It gets to be like it goes from very small to very broad, because everybody, just like you said, looks at the same information, but they look at it from totally different perspectives.
Of
We all have to
course,
come
of
and we
course.
all have to come together to basically keep as much money as we can so we can all stay employed and out of jail.
Exactly.
Now, we've talked about, I asked you about how being a nurse um, helped you transition, but what skill in particular do you think has helped you the most?
I think being a critical thinker,
Okay.
um, and I think that, um, and so when you're thinking critically, you are able to open your mind to other possibilities than the conclusions that you have arrived to. In fact, I think because of that, I'm I'm I've always been one to be very open to learning from others. So I think having like an open mind and being a critical thinker, kind of it leads you to kind of like, you open up one Pandora's box after the next. So you're just always kind of curious about what else can happen. Okay, so if we do this and this happened, I wonder what would happen if we moved that a little further. And how about if we include these, individuals and with their skill sets, how can we, accomplish this goal and be more efficient in this area? So I think that being a critical thinker has really helped me. I also think, again, being open-minded. I do have a commitment to learning. I could consider myself somewhat of a bit of a nerd, so I'm definitely always open to learning something new. And as simplistic as that may sound, I think a lot of nurses should really challenge themselves to learn something new.
Okay.
Um, yeah. Hmm.
So I wanted to ask because you have an advanced degree. You have a
Hmm.
master's degree in nursing education, and I wanted to ask, how do you plan to utilize your advanced nursing education in the HIM industry?
So currently, I work with individuals who are interested in learning about like risk adjustment and learning about like coding guidelines on a very basic level because I'm not a coder. So really just about the industry, connecting with people like yourself. Um, I I to answer that question best, I would probably say developing curriculum and as a consultant. So I don't do this through any institution. And I have divorced myself from the idea that nursing education, as it currently stands, is ready for somebody like myself. It took me a while to get there, but I've accepted that. I know I've spoken to you about this too, because I think that you're beyond the current education system as well.
Yes.
And sometimes when you deal with that, when you face that reality, you realize, okay, wow, I can't I can't just contain myself in the safety net of some institution. Like I have no problem working for, like I said, I work for a major insurance company, so I have no problem working in that capacity as a nurse educator. Well, I'm a trainer more so. So when do new hire trainings. So I've been using, I guess you want to say, if you want to say, my skills as a nurse educator in that way. Um, but I realized that I had to um, start my own consulting service just because of the fact that I feel like it. I've tried working in the traditional nurse educator roles, and it's just a lot of limitations. And too many folks that look like you and I also, um, we tend to not have the best representation amongst like faculty. So therefore, sometimes our voices aren't really heard, and some of the concerns that we may even find in our non-white um, students, that may also be somewhat of a burden too, because you could be overwhelmed just as an educator working with individuals where you're aware of all the other barriers that that these students may have to deal with, and then you're supposed to just act like that doesn't matter and just go ahead and teach a lesson while this person is telling you after class about all these things that happened to them before they came to class. And then but then someone like your leadership is coming to you asking you, oh, if she comes in late one more time, we're going to have to take her out of the program. And I'm looking at it like, okay, well,
Right.
it took a lot for her to get here. So I don't know if we just want to make that decision without, giving her or him, enough, grace, to, learn how to kind of make adjustments to be a professional. Because at the end of the day, the goal of a nurse educator is to model behavior for nursing students to have, the requisite knowledge and skills for them to be competent when they become professional nurses. So, yeah.
I just don't know. Well, this is a question that I hadn't sent you, but I want to
Okay.
get your because it just came to my mind. I want to get your take on, and I want your opinion on how do you think the nursing profession will change how nursing education is um, is handled in this country, given the pandemic and given just the whole exodus from nursing.
I think nursing education, This question is very interesting to me because I think that the current state of nursing education is not prepared for what is going on right now with the pandemic. So it's just interesting to see what is going to happen. You have a lot of nursing instructors who are retiring because I think the average age of nursing instructors, I think if I'm not mistaken, about between like 50 and 60 or so. So you have a lot of nurse educators who are coming from a time where everything was done in the hospital. You got to get that med surg experience or you're just going to explode. You won't be a good nurse. And so, again, as I mentioned earlier, with the shift for nurses to work in more care coordination and more outpatient care services, I think nursing education is going to have to, you know, is going to have to transform at the rate, or at least try to transform at the rate of healthcare for it to be relevant. Because right now, I think what's happening is if nursing education does not change, it's going to wind up being irrelevant. Nurses will be in nursing programs, or nursing students rather will be in nursing programs, maybe even considering quitting. We have also the issue of nurses uh, working in the profession for a year or 2 years and wanting to leave the profession. And why? A lot of it is because it's like someone was giving you a six when you were in nursing school, and then you came out in the profession and seen a nine. You're like, whoa, what's this? So our nursing programs preparing nursing students to work in this profession. The question would be, are the nurse educators prepared? So I don't believe, yeah, I don't know how nursing education is going to um, really deal with these changes because you also have a lot of individuals who are coming from a time where they didn't foresee something like this happening. I mean, all of us were just kind of caught off by surprise, like how do we make these adjustments? Interestingly enough, Interestingly enough, if you were working in the HIM space or if you were a professional coder, I don't think you were as disturbed. I think that should be something that people should pay attention to. I think if you're working in, let's say, even data analytics, your IT people, I don't think those in those professions, I don't think they were as um, their world wasn't as turned upside down. I mean, they could easily transition to remote roles, right? Um, it offered more information for them to have access to more data. In fact, I think those areas have grown exponentially because of what has happened with the pandemic. So I think if you are wise, you will move with what is going on around you. If you're getting the sense, if you're getting that little inclination, that little tingle in your heart and in your mind that you should probably shift more into IT and looking at health information management and um, ways to enter into that area of healthcare management, it's probably because that's where things are shifting. And you probably feel the sense that your basic nursing skills are somewhat irrelevant or um, could be if they're not fine tuned. They have to be fine tuned.
You know what I have found interesting, like what is shocking to me is like how the the impact that I had on you when you first met me
Hmm.
and found that I was a nurse and a coder. What I have found is that I didn't realize that it was. I don't think it's is as rare as people think, but it's just a lot of nurses and code or a lot of nurse coders don't put themselves out there like I have. They don't have
That's
channels
true.
to promote. So it's not like, it's not as rare as people think, but I think what it really is, being completely honest, is I think that it is more rare when you see somebody black.
That's true. This is true.
And what I have found, what is interesting is in the past, what's October? In the past 5 months, I've had two nurses reach out to me who finished nursing school, but one never took her NCLEX. One failed her NCLEX like 5 times. And she was like, well, I'm just going to go into coding. So I'm like, no, you're not. I said, no, no, no. I said, no, you've got this all wrong. I said, if you're trying to, I said, I'm not saying don't go into coding, but if you get your RN, you will go a whole lot farther in coding than you will if you just go into coding with a coding credential. I said, your first priority is to pass your NCLEX. And she lived in a state where you can take it as many times without having to take a refresher course. So I said, no, no, no. I said, so what exactly is the problem? So I'm on Clubhouse and I'm in Black Nurse Entrepreneur Group. And in there, they have tons, well, not tons, but they have a lot of nurse practitioners who help RNs pass the NCLEX. They have like study guides, they have one-on-one training. So I connected this nurse with one of those people. And I told her, I said, no, no, no. I said, you have got to get your NCLEX first. Then you can go ahead and if you want to move up or get into HI, an HIM credential, because she has a CCA, which in my opinion is useless, but she had her CCA. So the day before Thanksgiving, well, she took her test 2 days before Thanksgiving on a Monday. Tuesday, Tuesday morning, I woke up. She texted me a screenshot where she had passed her board. So she is now a registered nurse
Amen.
in Alabama.
Amen.
This is how it works. And I told her, I said, see, I said, you thought I was kidding. Because she had her RN, she applied for a CDI job at her hospital. She wasn't even working there. She just got her license, and she applied for a CDI position and got an interview. I told her, I said, listen, whether you're qualified or not, that's not for you to determine. They called you in for a reason. So now that you go in there and you sell yourself because trust me, if you did not have that RN behind your name, they would not have called you. So
Exactly.
that is letting you know the power of having a clinical background or some kind of indicator of your clinical ability to help you in HIM. Then another woman, this was just last week. She's in Texas. In Texas, you have 4 years from the day you graduate to take your boards. For her, it's been almost 5 years. So I told, and I mean, it's amazing how you learn all these things. So I told her, because I work with somebody else who I found this out. So I said, listen, I said, all is not lost. Because she was like, well, I'm gonna have to take all these courses over. I said, no, 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 you're not. I told her, I said, apply to Delaware. Send you up, contact Delaware, tell Delaware that you graduated from school in Texas and you didn't take your boards, for whatever reason. Then you just didn't take your boards. I said, Delaware will make you take a refresher course and you'll be eligible to you'll just take your boards in Delaware to be licensed. I said, I would rather do that than take all that all over again.
Mm-hmm.
So it's ways around. But I don't I'm glad that I'm at least able to, because if I hadn't talked to this young lady, she might have never even pursued her NCLEX again and just be like, okay, well, I'll just be a coder. Meanwhile, there's nothing wrong with that, but you are shooting yourself in the foot and you are missing out on way more opportunities. So
And you are correct. And you are perfectly correct. I actually I'll share a little something since about December, and I told you before, the number one Medicaid managed care organization in this nation has a niche little program in risk adjustment that they started a few years ago. And, when I interviewed for the role, yes, let's make this clear. Yes, I do work for a major insurance company as a senior analyst, but when you got the right information, you can shift.
right, that's right.
So exactly. So so they had their little niche, department, risk adjustment department, and it's led by someone with a background as an actuary, and so there is a lot to gain, of course, from that gentleman. I met with him, and he was so impressed. He's a senior hire manager. He was really impressed with my background and also with what I understood about risk adjustment and what I understood about clinical documentation, integrity, and also when I met with the team lead. She's a nurse actually, who she does have her CRC. And she said, you know, when I first started working here, I didn't have my CRC, but after about a year or so working with the coders, because let me also make this clear. Yes, there's sometimes is this whole nursing versus coder beef thing, but don't get it twisted. You are not going to be like that. Nursing license is special and nice and everything, but if you want to be dynamic, you're gonna have to learn from the coders.
Thank
So
you.
which she actually learned a lot from the coders and in that department. And so she went and decided to get her CRC. And she told me, she's like, I've never coded a day since I got that CRC, you know, her certification. But just imagine, she came from a background where she was a flight nurse. She was a flight nurse. She did some work in ICU. She had no risk adjustment background, no CDI background at all. She was asked to if she was interested in the position. And when she came in working in that role, meeting with the coders, that's what propelled her and made her feel comfortable enough to get her CRC. And she passed it on her first try, you know. And I'm only saying this to say uh, that is the kind of stories that I like to hear, because for me, I know for me, even interviewing for that position, she said to me, I've never, and the hiring manager as well, that they've never interviewed a nurse for this position that knew as much as I knew coming in. Most of the nurses, they have to train up. So again, back to what you were even saying, Jesse, about the nurse who said, "Oh, I'll just become a coder." Yeah, you can, if that's the option that you want to explore, but don't do it for that reason. If that's the reason, like if the reason is, well, I still think I'm going to be a nurse because I just can't pass. No, you know, this is the same thing with that nurse who decided to get her CRC. She wasn't thinking about, oh, well, you know, just because I probably won't be coding, I shouldn't get it. No, she went ahead and got it. And even for myself, I'm pursuing my CRC largely because I truly do love risk adjustment. And I do believe that it's important to challenge yourself. You know, never ever um, put yourself in a position where you're telling yourself, I just can't do this. Let me make this also very clear. I was extremely intimidated. Jesse can tell you, I was extremely intimidated when I first started learning about coding. I was like, we'd be working on scenarios, and I'd be like, Jesse, what are you talking about? What are you talking? I'm like, how do you know this answer? And he's like, a coder. But I mean, it would be things that I would just be, I was looking at the scenarios, I'll be looking at the questions, and I'm like, what? Because again, and Jesse knows I say this many times, the coding manual is in the alphabetic index is in alphabetical order, but it is not a dictionary. Okay. It is designed in a very specific way, and you
Right.
have to understand how to use it. That's the reason why you have to understand coding guidelines. But again, with all that being said, that appreciation for understanding HIM, understanding and wanting to understand revenue cycle and wanting to understand the professional coding role is what afforded me the opportunity to even get offered a position such as a risk adjustment specialist in a very niche area for, like I said, not number two, not number three, the number one Medicaid managed care organization in our nation. They gross about 10 billion a year. So
Okay.
this is no small company. This is no small, you know, department. But you would not be able to do that if you don't have that information and you're not invested in that. You know, so instead of buying that next Louis Vuitton bag and that next Birkin bag, or taking that big trip, you can get yourself ICD-10 coding manual, maybe even an AAPC study guide. Put those two things together, and I think you'd be good to go. You know, if you want it, and this is without the CRC. Again, I don't have my CRC yet. I'm going to be getting my CRC, but I don't have it yet. So this is what
Right.
I was able to do with just having the knowledge.
The
And I
knowledge,
also want to
that's
make
right.
this, yes, I want to also make this clear. You can understand this information if you dedicate your time to getting the basics of it in a, maybe let's say a 10 to 12 week course, and then 6 months of committing yourself to really understanding this information. I really think that you could, and I say you, I'm referring to nurses who are not certified, who are completely new to this information. I think you could definitely start looking at opportunities working, at least if nowhere else, you know, working in CDI. But I don't think that nurses really understand the opportunities, because when they think about coders, like you said before, Jesse, they see this little white nerd.
Mm-hmm.
You know what I mean? So, so with that being said, I think a lot of opportunities are missed because of that as well. And unfortunately, I can understand it. I'm not going to act like I don't understand it, because
Right.
who feels as a nurse comfortable walking up to your HIM staff, especially if that person doesn't look like you, bothering them, asking them questions about what they do? I mean, it
Right.
sounds cute. It sounds cute, but in the reality of it is that you actually have to like meet with someone who is open. And Jesse actually happens to be an open person that will give you that time, so and open up his schedule to discuss, hey, well, why are you interested in doing this? What are you, do you, what are your skills that you're coming to the table with? Those are the kind of conversations that he and I had. And this is back in 2018. Just want to make that clear, because I don't want anybody to think that
Yeah.
this is something yesterday.
Right.
This is not yesterday. So, yeah.
So it's this is just, I mean, I'm just so glad that this was my inaugural, my premiere episode, and it was with you. I'm just so over the moon right now, and I'm just so glad that you were able to do it. And I just, I mean, I want to be mindful of your time, and I know we got started late, so I don't want to take up too much of
Oh,
your
we can
time.
go. No, we can go. We can go. I readjusted my schedule. Go ahead.
Okay. Because I
Hmm.
wanted to, because this is the whole, because it is all about transferable skills, and it's all
Yes.
about how you think about the skills you have versus the skills you need to learn. And it is the one thing that I do enjoy about coding is that you it because in nursing, like nursing, like they say you have to have your CEUs, but we all know, I know I've done it for the past 20 years. You pick the easiest CEUs where you don't even have to take a quiz for real, for real. You just fill it
Hmm.
out, send it, and then you get your license for 2 more years. But it's not. Let's keep it 100. But in
Hmm.
coding, the C you really do need to know, because the guidelines are constantly changing. Guidance is constantly changing. You have to really keep up. I mean, honestly, like I'm sure they had the five rights in the 1800s. The five rights have not changed in nursing. They have that those are as a staple. I mean, that's not going to, what are you going to cut it down to four? Okay, you don't have, it doesn't have to be the right person anymore. I mean, I don't think so. So, so I just think that it's it's all about, and I put, Clarice's comment, I showed it on the screen, is invest in yourself. It is up to you to continue your growth and to continue your learning. And yes, your job can facilitate it or it can help you, but I mean, anything I've learned, I haven't even requested that my job reimburse me for it, because it's going to help me. I'm going to get mine in the long run. This is an investment. It's going to pay off. So I just want, if you walk away with nothing else, know that you have to continually learn. You have to invest in yourself, and it is possible.
Of course. Of course. And again, going back to when you say invest in yourself, I think, you know, we live in a time where I think a lot of people do things, and it's kind of, we live our lives kind of like inside out. So a lot of our more personal information, people will jump on a live and they invest their time in showing other people. Like, it has to be something that has to be seen. Other people have to see it. And I think oftentimes with this kind of investment, it's not really something that people can see. Half the time, people don't even know what you're talking about.
Right.
So you can't. This ain't something about the brag. This is where you're gonna. This is where the phrase "greater later" applies. The benefit is down the road, because like right now, I have built a consulting or educational consultation, or educational consultant. Let me put it that way. Um, Company, not for now. I'm talking about for 10, 15 years from now,
That's right.
you know, because for me, I see where I can go 10, 15 years from now. I was that nurse who let every single nursing title, every single company I worked for, every single organization I worked for define me. And and I can tell you, when you hear nurses saying that they're burnt out, It's because they're letting that place, the title, define them. You can't look for that kind of validation out there. You have to invest in yourself. Don't be worried about how people are going to perceive what you're doing. Sometimes I know people probably think, like, oh, yeah, you're a nerd. I don't know what they're thinking. But and I don't care either, because
Right.
like I said, when it was time for me to say, you know what, I'm interested in this position over here. I want to look about this. I don't have any problems getting up and picking up my purse and going to another job. I have no problem doing that. But if you're stuck, you're stuck because the questions I'm going to ask you is, how are you investing in yourself? Where's the attention being paid to what you need, the seeds you need to sow into your life? And I mean, Jesse knows, even in those early stages where I was just learning this information, learning about the world of coding, medical coding in specific, I didn't know anything about this. I had
Mm-mm.
some little inclinations. You see the ICD-10 codes and the patient's records and stuff like that, but you don't really know what you're looking at, you know. And then you may even have people who they're telling you to. I remember the one role I was in. They're telling you to just slap the ICD-10 codes all over the paperwork. Just slap it on there. So as a nurse, you wouldn't even have any respect for ICD-10 codes. You wouldn't even know that. Like, who's worried about them being specific? I just Googled mines. Like, you
Right.
wouldn't even make that connection. So you have to invest in yourself if you want to have a seat at the table and not be on the menu. And that's why a lot of these nurses are getting burnt out, because they are at jobs where the place that they're at right now, they're not taking what they need to get from that. Take the information that you need to get from that place and keep it moving. Them CEOs and
Amen.
all them other people, they move and move and move until they get their feet settled somewhere nice and cushy for themselves. So why is it that you're standing there complaining, oh my God, they're trying to work me to death? Of course they're trying to work you to death. You don't have anything else to offer.
Right. Oh, and to piggyback off what you said about just slapping codes on and not having any respect, how about one of my students? Just this past Wednesday, we were in class and we were finishing up chapter one, which is an infectious disease. So we had done sepsis. We're into cancer
Hmm.
now. So she was
Okay.
saying how at her job, she had come across this chart where the person had been discharged from the hospital for sepsis and a UTI, and she
Hmm.
said that the nurse had coded the UTI as the primary diagnosis. So I asked her, I said, well, is the patient still on antibiotics? So she said, yeah, they're still on IV antibiotics. I said, oh, I said, well, what she did, I said, she just cost her, your agency money, because if the person is still on antibiotic therapy, then they are still treating the sepsis. So as long as it is still an active condition, in the home care setting, and they're definitely there to monitor the IV,
That should be the
and
primary
the
one.
antibiotic, exactly, sepsis should be your primary diagnosis. Then the that'd be your 1021A, then your 1023B would be UTI, would be the N39.0. So she was like, I thought so, because I know you said that, because we had just got finished, doing sepsis, and how when sepsis is documented, that is going to be your primary diagnosis if it's,
Hmm.
if it's still being treated, and if it is, present on admission. So, and it was still technically present on admission for the home care. So, and it's just not knowing. That nurse probably doesn't know. Nobody probably really educated her on, the guidelines for sepsis.
And now
But
just imagine training that nurse. When you said nurses
right,
always asking why, imagine
right,
talking to her after somebody told her to do that.
right,
Somebody told her it's okay to do that. No one told her, that's not the way you do that. Now you now come and tell her, yeah, you know what? I don't know why they had you doing it that way. Now you have to undo every assumption, every belief, every thought process that made her think that that was acceptable. And that
right,
that's like unpeeling the onion there, because now you have to get to, you know, removing all the assumptions that that's how it works, and that's not how it
right.
works.
Right. Now, what advice would you give nurses who are interested in transitioning into the HIM industry?
Okay, first, you have a network of people right here on this call, because if Miss Clarice is there, Jesse's there, and I'm here, you do have a network of people right here that you can reach out to. So that's your first step. You need to be able to reach out to somebody. Um, I would say, I would probably say I would probably say reach out to someone first. I would never advise somebody to get all overwhelmed searching things on YouTube, because the way I look at it is uh, like Google. The way they used to say about Google, trash in, trash out. So you don't know what people are out there talking about. People
Right.
can mislead you and
Right.
say things that are not necessarily um, according to coding guidelines. It's just their own personal ideas, and they could present it very well and make you think that this is exactly how it works. So I would probably say find a trusted resource. Find out first. I think, Jesse, the advice you mentioned about start where you work. Even if you hate your job, there's something about your job and somewhere in your job where they're collecting data, and they're collecting the same data that you're probably working with every single day, or that you may, even as a nurse, you're inputting that in the system, right? So if you are, doing data entry, pay attention to like the flow of where that information is going. The analogy I like to use is, when you're working at a job, and this is beyond nursing, this is not just exclusive to nursing. If you're the person at the front desk and you're the person that they hand the folder to, then there's another person that opens up that folder, right? And then there's a person above that person that may read what's inside of that folder. And then you have another person that may make decisions about the information in that folder. And then you may have a person who's above the decision makers, and they're more just of an investor, right? So that's kind of like your 101 in business analytics, right? What happens with the data as it moves up the chain, and who are your key decision makers? If you want to not just be the person who the folder is handed to, and you don't even ask questions like what's in this folder, but you want to be at the top with the decision makers, you are going to have to invest in yourself. I think Clarice had pointed that out in the chat, and I would just echo those sentiments. You have to invest in yourself. No,
Definitely.
it's not going to be sexy. It's not going to be cute. It's not going to be Instagram worthy. It's just going to be you investing yourself. Maybe you're going to have to pull away from some folks. Maybe you're going to have to pull away from just your casual entertainment, because you're going to have to really challenge yourself. And the beauty is when you see the growth and that you have been able to uh, the skills you develop, the growth you observed in the way you're approaching things, the way you think about things, when you see new information, how it applies, and you just get it, you just notice, man, I'm really getting good at this. I would say those are the times where I would say then, look at somebody like Jesse, who has a program where you can like lock down and really get a lot of like that intense and get that one-on-one support, or work with a cohort in like a training program. Because again, it's not a sprint, it's a marathon. So you're going to need that bulk of information to be given to you. Definitely going to have to familiarize yourself with coding guidelines. You can do that before enrolling into anybody's program. Right now, I work with a group of people, and I just do it for free, where I just work with people who are interested in understanding, like reading the coding guidelines and just understanding the basics of like ICD-10 coding, like very basic. But when you get into the levels where you're really trying to get into like getting your certification, I think it's best that you link with people who are certified, and that you can have years of experience, so you can gain something from them. Ask all your questions, right? Get all your questions out, But again, investing in yourself would probably be the most simplest advice I would probably give anyone. Invest in yourself. That's the time, the resources. Don't be afraid to look up articles. Just from trusted resources. CMS has a wealth of knowledge. The The Learning Network, I think is called MLN,
Yeah.
um, is a
Mhm.
great resource. They have nice little PowerPoint presentations about a lot of information. If something is over your head, Google it. After you get the information from your CMS, your reputable sources, you're working with somebody like Jesse, you're working with somebody like Clarice. Um, you're going to be able to get, you know, trusted information. Then you can now be able to kind of do some more research on your own. And again, that AAPC study guide, I think is a great resource. When I say it's a
Yeah.
great resource, the way they designed that book in a way where even if you were not going after your CRC, although I don't know why someone would get it if they weren't getting their CRC, but if you just wanted to kind of get an understanding of risk adjustment, there's a lot of great practice questions in there. They do a nice little summary of the ICD-10 coding guidelines. They make a lot of connections about chronic conditions that are commonly coded and like coding errors, and so you can get a nice idea of what um, the world of like risk adjustment is and that methodology. So I would probably those are my bits and pieces of advice.
Okay.
Connect with someone who knows and invest in yourself.
And what skills would nurses need to develop to support their transition into HIM?
Skills. One, you have to have bills you want to pay. Do you want to make more money? That's a skill. Paying bills is a skill. I don't know if everybody is a city girl out here, but if you got bills to pay, that's a motivator. That's a skill. Paying bills on time.
Right.
So that I would say being curious. So having good study habits. And when I say study habits, even if you're not going after a certification, like have the interest and the ability to like kind of lock away and read. There's a lot of reading. This involves coming into HIM. If you're interested in transitioning from the bedside to other areas of healthcare, it's going to that shift is going to be largely based on what you know. So you're going to have to buckle down and study. So having good study skills, being comfortable with working with people who come from different backgrounds. Like I said before, um, coding professionals, let me just say this. The group that I'm working with right now, they're made up of nurses who are coders and also um, coders. And when I say coders, I'm saying they have the CPCs. And so the cool thing about that is the way each person approaches when we go over scenarios and we do practice questions is interesting because they all have different approaches because of what they do every day professionally, right? So some have, having a background, let's say in home care. One works for a university where she's coding for med school, and just the different ways that people approach, you know, uh, coding and how and the code sometimes the way they arrive to understanding some of like the coding scenarios. If you again if we're preparing for a coding exam, working with a group of people who are and being open to working and learning from different people from different backgrounds, I think is very important. You can't look at yourself ever, especially as a nurse, as oh well, I'm a nurse, so the only next thing is to be a nurse practitioner or a doctor.
Right.
Like, come on. If you work in healthcare, you see everybody walking by you while you in your scrubs trying to figure out how to get the medication door open and fingling dingling with your keys. All them people in them suits walking right by you. All them people that they can take off when they want to take off and making good money, making way more money than you. Um, they got where they're at. I'm not saying that they probably don't know the right people, but it's because of what they know, the information they know. So, you have to be open to learning from other people, especially in this world. You got to, if this area, you have to be comfortable learning from coders. If you're a nurse, you have to be comfortable learning from coders. Everybody is not comfortable with learning from people who are outside of their profession. I don't know why, but everybody isn't.
And who, and also people they perceive to be less educated. Because in nursing, we know there's a hierarchy and people love to tout the letters behind their name. And if you don't have as many or the same, you can't really
Yep.
tell me too much.
That's why they got those nurse practitioners with all that alphabet soup going behind their name. Um, you know, and then you ask them something simple about coding, and they're sitting there like a deer in the headlights. And no insult to them, but
Right.
again, I think a lot of that, those. Well, I got my own personal theory about all those letters. I think a lot of it is kind of like, okay, like it's a little overkill sometimes, but
Because I
because you've
go
seen
ahead.
them before.
Mhm.
You've seen them before. I mean, certifications are one thing, but you know what I'm talking about.
Right. I mean, I had a nurse practitioner take my coding course in 2020, and I told her, I said, you have no idea how one credential can change your life. Like you can
Yep.
go into a whole nother direction, and you think that because you're thinking, oh well, I can't make the same money as a nurse practitioner. I said, first of all, let's be very clear. You're not making the 200 grand a year. So let's just really keep it a buck,
Mm.
you
Uh
know?
oh.
And
Uh oh.
and and I sent her a job. They would look this insurance company was looking for a physician advisor remotely,
Mm.
100 grand.
Mm.
I said, all you have to do is get your CRC. I said, for all that you have learned, because she did my ICD-10 CM and PCS course. I said,
Mm-hmm.
you just have to, I could help you, you just need to learn a few things. You just need to tweak it a little. And I'm telling you, apply for this job and tell them that you get ready to sit for it. And then I could, it was right there. She didn't do it.
She
And
didn't do it,
she didn't.
and
And has,
and the thing about it, wow, that's interesting because I know you. And I know that when you had that conversation with her, you were very transparent about the opportunity and you were very clear about the benefits. So when I know what she said no to, because I know you, and so I know what she said when she said I can't do it. I know what she said. I know what she actually turned down, and that says a lot. Again, especially us sisters and brothers in healthcare. If it's nothing as much, we're in Black History Month, so I'm just going to be transparent. Yes, you do. We're gonna have to. We still jumping higher. Yep, we still running faster. And in if you want to, as the professional reimbursement network, Miss Clarice is pointed out here, you got to get them skills to pay the bills. And you were dead on when you said that, Jesse. No, you're not making it $200,000 because that is exactly how the nursing, especially the nurse practitioner role, often is marketed to the nurses is, oh, you're going to be making this money, you're going to be making this money, and then you work in the profession, you're like, whoa. I'm doing every single thing that the medical doctor saying up here, the MD saying that he don't want to do. Or when this MD is getting out, on vacation, all this work is being dumped on me. So and writing notes all night. Your life is completely and totally, you know, consumed by this work. And you're not getting paid what the medical doctors get paid for working the 80 hours. So let's be honest. What you said is exactly right. Let's be honest about that.
And I think what I have found, because I just need I need to let everybody know that when Raquel and I were working together, see, the reason why Raquel and I were able to work together, period, was because Raquel was serious. Like when I tell you, see, they don't know Raquel, we would be on the phone for hours. It
Okay,
wasn't
did
just
you
no
say
10
ask for
minutes
that? Did you say hours with an S? Because I think you need to
with an
say it with a
S.
Z.
Yes.
You need to
Okay.
say hours with a Z.
Hour, and I mean not just one day, daily.
Yes.
she, she'd be like, listen, give me a couple minutes. I got to put this baby to bed. And when he go to sleep, can I call you? And we would be on the phone for hours with a Z, getting it done.
And that's how I know it can be done. I know it firsthand. When I say I know it firsthand, I know it can be done. I know for a fact that Jesse is the man with a plan. I know it for a fact. I know it for a fact. So, and I mean, I hate to be so biased in this way because for me, you know, that's just the only way I can see a person actually learning about this information, whether they are a nurse or not. The only way I can imagine it is through that commitment. You have to have a study habit on you where you are curious about making those connections. Now, I know for me, it was just like music to my ears. And so that's why I had went on and kind of continue to invest in my education in this area. But I think a lot of nurses, they do themselves a disservice because I have had many conversations where I try to use me being a nurse educator as a kind of like a drawing board for somebody, kind of, bait to bring nurses in. And they're like, oh, I don't know if I want to learn that. But you want to be a nurse practitioner. Don't you have to learn? You're going to be learning about prescribing, right? So it's not that you have given up on learning. You just think that you can't learn coding,
But
you
see,
know?
and I think for some people, I think it's the cachet because see, they think I just got to go there. They think that when you say building and coding, they're thinking about that Chubb Institute commercial they saw in between in between the commercials between for the Bold and the Beautiful. So it's
That's why I
not.
don't even mention billing. I don't even mention the word. I have to often not even mention the word billing because of what you just said. I won't even mention the word billing because
Yes,
because it's often interpreted as medical
yes.
billing and coding. So I always use the term medical coding. I even sometimes will just stray away from saying medical coding and saying ICD-10 coding, if I'm specifically talking about ICD-10 coding. Because of course medical coding is a lot more comprehensive. But when you want to use the term billing, it throws everything off because everybody, oh, what do you think I'm going to be an MA? They start getting that. You start going in that. You start having that kind of
But
thing.
but this is how short sighted they are, Raquel. There are people who own billing companies that make $30,000 a month.
Tell me about it.
Girl, I mean, the money is I mean, people just get so caught up off these titles, and it's not about the
Yes.
title, it's what you do with it.
Now that's us, Jesse. Now don't get it twisted. That's us.
Hmm.
That's when I say that's us. I don't, not to get off too much on my social platform here, but I think that education has been designed for us. This is Black History Month, so I'm just going to, preface it by saying that for us to have that limited way of thinking. So, there was a time that being a nurse was like the greatest thing in the world to me. Then I was a nurse and I'm like meeting all these other people. I'm like, oh, and they do this and they do this and they do that. And so a lot of times we're not exposed to things until after we then already start, checking our money off. We then already then picked up a whole bunch of school debt. So now other things that we should have maybe known earlier or could have applied a little bit earlier in our learning, journey, we are applying a little later and kind of like not having as much stamina to kind of complete things. And so that can become a barrier. But that's often what our problems are, is that we just don't know. And then when it is time to know, we're like, I don't know if I still got it in me. You know what? I always say, there's something my twin recently said to me when I told her I was going after my CRC. She said, yeah, sometimes you got to tell yourself, yeah, this old brain can still work. This old brain can still work. I'm sure. Jesse, I know you understand because you have been very committed to learning and you can see it. You can see it. I see it, all the certifications that you have acquired, even from the time that I met you, and which is always very inspiring. It's very inspiring. I love what you are doing. I love the shift. I love, just hearing you speak. It is so refreshing. I think every nurse should at least have some time to listen to somebody like you just present to them, especially as a nurse and especially as a Black nurse and a Black male nurse, and more importantly, because you represent so much, and I think that it's a great opportunity for nurses, Black nurses in particular, just to excel if we are, connected with the right people and given the right information, resources, and opportunities to apply this information for our own, professional growth and advancement.
Now, can I tell you? I just want to. I can't let go of this billing piece because it is just
Hmm.
because that Chubb Institute commercial was really it. That's really it.
Hmm.
that was a good
Mhm.
that was the Lord's work right there. So
Mhm.
um because I wanted to talk about how I got my billing credential.
Mhm.
I only when I got
Mhm.
it, I had no interest other than I wanted to learn about the complete revenue cycle. I wanted to know for
Mhm.
me, not for a
Right.
job, for me.
Mhm.
This is how it works. Full circle in 2022. There are people. I just got off the phone with a nurse practitioner in North Carolina last night.
Mhm.
She has her own IV hydration business that she does for cash. She's starting to do clear lab like point of care
Mhm.
testing. She
Okay.
wanted to know if I could train her to do her own billing. I said yes. She said, "What's your rate?" I said $100 an hour. Miss Thing
Mhm.
didn't flinch. She was like, "Okay, well when I get set up, I'm going to call you."
Mhm.
Now, I could go, of course, if you want to go get a job working for a billing somewhere for $15 an hour, you can do that. Why not market yourself? You have the skill. Why not
Yep.
market yourself and really go out there and make some money?
Mhm.
That's what I mean. People just because it's the knowledge. It is the knowledge that you have that you can really impact and make a difference.
That is completely correct.
And I wanted to really quickly, I have this comment pinned by Misty. She said, I think people get scared to be remote and brand new in the field. Now, Misty, remote doesn't mean alone. Like when you say you work remotely, that doesn't mean that you don't have support. It doesn't mean you don't have training. It doesn't mean that you don't have people you can go to when you have questions or need some answers. You know, you're not alone. You just work at your house. That's it. But you're not alone.
And maybe also people may feel that if they're working remotely, I'll tell you one thing. I found, and I've seen studies showing now ever since many roles have become remote, and I've been working remotely for the past couple years now. Um, Actually, ever since I met Jesse, I've been working remote. I'll let you, I just thought about that. Um, I've been working remote, but I think what happens is that people don't really realize like you actually become more productive when you're working remotely. There's less distractions. And so you'll find yourself very much, you know, looking at your workflow and what you're doing and, communicating with the right people and getting information because you don't have the cumbersome, the barriers of um, the on-site, you know, work environment. So there are definitely some benefits working remotely and feeling alone. You'll be surprised, depending on your personality. You know, I have made great friends with people I work remotely with who I've never seen
Yes.
and had very good relationships with them. We work together, we get things done. We even find a little time on the side to gossip. And I mean, this is a complete
Exactly.
stranger, but
Exactly.
you'll work with people and you'll find your little friends, your little buddies, and people that you can connect with. So yeah, I haven't found that actually. Um, feeling alone or feeling, that kind of fear.
Exactly. I mean, I've had some amazing managers who I work remotely, under, and they are accessible. I mean, you send them an email, I need some help, or you call them, they pick up on the second ring. Okay, share your screen, let me know. We'll talk about it, and you just move on. Like you get what you need, and then you go on until you
Hmm.
need some help again. Then you come back.
Amen.
So it's just there's just so much opportunity, and I just think that we just don't need to limit ourselves. And I think that there's always someone that you can learn from. There's always someone you can inspire. There's almost always someone you can be inspired by. So I just think it's a give and take, and I just think as long as someone is willing to share, and I'm telling you, like that's why I keep so like Raquel is really really pro education, and she's all about learning. I mean, she we used to go for hours just talking about HIM and coding, and well, why is this? Well, how about this? And oh, now I see why. Is you and then like the connections start to be made, and that's where it all happens.
Yep. And again, nursing is dynamic. HIM is even more dynamic. So if you are looking for opportunities to advance, I would say definitely don't be afraid to look at some of the expectations for job postings, and start doing your research. Start looking at, like, okay, look, what are some of the regulatory bodies expecting for a person working in this role. CMS has a lot of information on certain, like, guidances they have for coders. And so I think that's a nice, well, it depends on, let me be careful when I say that, because sometimes I don't realize how advanced I may be in certain things just because I don't have my coder certification. I'll say things like that and not realize, like, ain't nobody gonna search on no CMS website. But
Right. No, you have people who are credentialed who don't search on the CMS website.
listen, right? Exactly. Exactly, right? And they sitting there looking stuck when everybody getting written up. They
Exactly.
bringing them in a meeting. Yeah, they bringing you in because you didn't did some stuff you wasn't supposed to do. Talking about something your boss told you to do that. Did the coding guidelines tell you to
Exactly.
do that?
Thank you.
Exactly, right? So yeah, I would definitely say that I I'm big on promoting lifelong learning. I think you never know too much, and you can never learn too much from someone.
Right.
Mhm.
Well, Raquel, we have been on this hour and a half. Can you believe it? Like, time flies. And
It's a blessing.
yes, we're going to have to. I mean, we can continue. We're going to have a part two at some point because we still have some other points we can flush out. So
Of
I
course.
I know that this is Black History Month, and I know you have something else coming up. So I would like for you to share before we leave.
Yes, thank you very much. So, the Association for the Study of African American Life and History, the ASALH, they have an author's book talk. So, Tuesday the 8th. So this is just this Tuesday at 6:30. I will be doing an author's book talk event about culturally competent nursing and evaluation plan. It's a book I wrote as a resource for nurse educators, to have more of a some guidance, recommendations on ways to integrate cultural content and promote the evaluation of cultural content and evaluation of the attainment of cultural competency after the cultural content has been taught. So, oftentimes, let's say with the American Association of College of Nursing, on the baccalaureate, master's, and doctorate level, they have core competencies in culturally competent nursing education that they recommend and they suggest for nursing programs to have included or integrated in the curriculum. However, they lack the evaluation process, or even an examination of the curriculum, the actual nursing program curriculum, to see if nurse educators are measuring if the students have attained cultural competency. We know that that's not the case with anything else you learn in nursing. If you in nursing, if you are taught how to administer medication, you're going to be expected to show that during clinicals, right? So if you are um, provided education and cultural content, it should be something that the nursing student is demonstrating when they have their clinical learning experiences. So really, this book is really about offering resources, evaluation tools, evaluation of the curriculum, evaluation of the students' learning, evaluation of barriers that nurse educators are finding from academic year to academic year, or even throughout the semester, in integrating cultural content in nursing curriculum. So this is a book talk event again at 6:30 on February 8th. It is the author's book talk event. The ASALH, the Association for the Study of the African American Life and History, their YouTube channel is where you'll be able to see this book talk, and it will be covered, or aired rather, on C-SPAN. So if you would like to view it on C-SPAN, it will be available on C-SPAN as well. But again, this will be a live online event from the ASALH, and this is 6:30. I will be speaking, but the event actually starts at 6 p.m. and it is the author's book talk. So there's going to be other authors, I think about three other authors beside myself, talking about some work that they're working on. And this year, the ASALH, their theme is Black Health and Wellness. So I'm sure there's going to be a lot of information that they will be sharing for the viewing audience.
Okay, Raquel, Misty wants to know how can we follow you? So do you have any social media you'd like to share?
I actually do.
Okay.
So a www.acd4n.com, four like
Wait,
the number
wait,
four. So
wait,
A
wait,
is an
wait,
apple.
wait,
Mm-hmm.
wait, wait. It's a website.
Website, and you can follow me on Instagram.
Okay, so okay, the IG is at okay. Tell me. Mhm.
ACD4N. A is in apple, C is in cat, D is in diamond, four as in the number four, and N is in Nancy.
Okay, IG is at ACD4N.
Yep. And if you want to follow me on Twitter, I don't do much on Twitter, but you probably see some postings of this event on Twitter. I am at ACD4N underscore LLC. And then my website is acd4n.com
Okay, and website.
at www.acd4n.com. I actually have a link to this live right now on or on our events page. So if anyone is interested in watching a replay of this live, you will be able to go to that website, go on the events page, and click the link for enter, and you will be able to see this interview playback.
Okay, so I'll put your information on the screen so they can see and they'll be able to
Hmm.
follow you. So, Raquel, I cannot thank you enough for your time and your energy and your feedback.
Jesse, I blame you. I blame you for the view, for the listening and view audience. I blame Jesse. When he seen me say, I want to get away from this bedside, I remember that day I walked to you and I said to you, I said, I need a change. And I sincerely believe that you heard my cry and you said, you know what? I'm going to work with you. So I blame Jesse. Y'all blame Jesse, okay? I thank the coding nurse for what has been doing and what he is going to continue to do to impact the lives of others. And at this Black History Month, I hope that this is a transformative year for all of us who are in healthcare. This pandemic has been very rough on many of us, but particularly on within the Black population, we've seen a lot of issues like with complex care management and just coordination of care and just all the barriers that have come just from a social aspect with the pandemic. So I think that this is a great time for us to rethink some things. And if there's any nurses out there who are interested in, um, you know, getting into this space, please reach out to the coding nurse. He is the person who's taught me everything that I know. And he is also the nurse that inspires me the most because of his bravery just to be out there, to be bold, to be a leader, to be responsible, to have that kind of commitment. And interesting enough, I hate to go on this tangent real quick, but when you said what you said about nurses being so preoccupied with letters or like status, whatever, and yes, there's some truth to that. I will say this. Jesse has always been a very humble person when it comes. He has never let his education um, be the reason why he cannot um, share something with you, even if you just don't know. Like, I could ask him anything. It wasn't never like,
Thank you.
girl, I no, you could ask him anything. It
That's
was
true.
nothing
Thank
ever
you.
I felt stupid, like it was a stupid question to ask because of how comfortable he makes you feel about asking questions. And the rest is history. So thank you so much for having me on your program, and I wish you nothing but the best. And I'm looking forward to the next time. I'll look out for a message from you to let me know that you are ready for us to meet again.
Definitely. And I found out where the live button is because what happened was I'm on two screens. So I moved my screen from StreamYard onto my smaller laptop screen, but it didn't resize. So I had to drag
Hmm.
it over to see the live button. So now that I know I have to look out for it, we'll be straight and we'll start on time next time. I just thank everyone who was in the chat, everyone who was able to listen. And if you didn't weren't able to catch it now, you'll be able to catch the replay. So I just thank everyone for being in attendance, and I hope everyone has a great and enjoyable rest of your weekend, and we'll be in touch soon. Thank you,
Yes,
everybody.
thank you.
Bye
Thank
bye.
you. Bye.